Hi, this is Dr. Scott Threde with Top Down Inside Out Chiropractic, and today we have Sasha. Sasha is a ballroom dancer, and he wants to improve his flexibility and his pelvic alignment so that he can perform at a higher level. So we're going to check him out and see if there's any asymmetries, and then see if we can resolve them real quickly by clearing his nervous system. All right, enjoy the video. And this is Sasha. He's a new patient, and we're going to check him out. Sasha's a ballroom dancer, and he just wants to perform at a higher level, see if there's any asymmetries in his body or any tension in his body that we could eliminate for him so that he can perform at a higher level. So this is an interesting case because a lot of people come in only with pain, and that's their motivation, but we also work on a lot of athletes and performers that just want to be better. So this can happen for you as well. Okay, so Sasha, let's start with your neck. I'm curious about your neck. So rotate your chin to the left as far as you can. So this is 90, it's about 70 degrees back here to the right. So there's a lot more range of motion in his neck to the right. Come back to neutral, I'm just gonna extend back. Okay, pretty good extension. Arms out to the side, and just resist me, see if there's any differences in strength. Thumbs down. Okay, that's good. Okay, we're gonna go ahead and relax your arms, Sasha, that's good. See, from here, let's have you lie on your back. All right? We're going to see if Sasha has any asymmetries like we talked about previously. He's one of the top ballroom dancers in the area. So he's humble. So come over here. I want to show people that there's a subtle difference in his left leg check versus his right. That's not dramatic. It's really very, very close to neutral. That's great. And so we're just going to see if it plays out in any way. Since he is a ballroom dancer and you have to pick people up and things like that, we're going to see if it plays out at all in any flexibility issues or anything like that. So Sasha's flexibility is not what you'd want in a high-performing ballroom dancer. This on his left side, that is, but on his right side it's pretty open. So dramatic difference. Let's do the left again, so just make sure that we're clear on this. Starts to get uncomfortable at about 75 degrees. This is also the side that the leg check was short, that's the way the body works in that pattern fashion. Okay, so let's check your neck for any pressure that's in the way here. Right out the gate, right at the base of your skull on the left, C1 left, C4 and 5 right. Okay, while I have you here, I'm going to do a test called George's test just to make sure your cardiovascular system's okay for adjustment. So I'm going to take the pillow out and then have you move up to the top of the table a little bit here. Your eyes are open for me, and I'm going to put your neck in a position where we can see. Is there any dizziness there? Okay. Any dizziness there?
Nope.
Okay, so Sasha, how old are you, Sasha?
20.
He's also 20 years old. He's not at a high, it's not somebody that would ever worry about, but just as a protocol, we check. So we're going to have you go down over on your face, and we're going to see. I'm curious about hip extension because your left leg really isn't the same as your right. So I'm sure in competition that plays out. You just probably don't realize it. Without bending your knee, bring your left leg up to the table as high as you can. Okay, we saw how that moved, and now do your right leg. It's subtly different, but I'd say the right leg definitely moves more. We're going to see if we can change that right now. T1 and actually T3 and T4. You feel that tension right there?
Yeah.
Clear here, clear here, clear. T12, L1, and then L5 on the right. All right, I got it. So over on your back. Let's do one other thing. I know you're not complaining of dramatic pain, but let's try both feet off the table and meet my hands together. Is there any tension or pain in your lower back? Can do that.
A little bit, but not too much.
On which side? Or is it
lower left.
Lower left, yeah. So one thing we've already seen in this exam here is that the leg check was subtly short on the left. Remember, this is somebody that doesn't have a lot of symptoms. He's just looking for higher performance. And his hamstring was dramatically shorter on the left. Also, when he was face down, he couldn't extend his hip. So we know the nervous system is contracted here on this lower left side. It's obvious to us. We also know that there's a tract, a nerve tract that starts in his brain that descends through his neck, his upper back, his middle back, and then his middle to lower back, and then it comes out of his spine, top down, inside out, out to all the muscles in this area. In a second here, we're going to start clearing that pathway, that tract, and see what the results are so that he can perform at a higher level. Okay, does that make sense? Good, so away we go. And Sasha hasn't been adjusted in a long time, so we're going to start upper cervical right at the base of his skull. Hang in there. There you go. And then we'll go a little bit lower down here. We had C5. Good. And
Forgot what that feels like.
yeah. How long had it been since you've been adjusted?
Oh god, the last time I was in like 6th grade.
My goodness.
So, 8
Yeah, I
years.
think, and this is important. People are walking around with these imbalances, and because they're not dramatic, people don't realize that they could be working at a higher level or performing at a higher level in any aspect of life if they simply got adjusted like this. It's not complicated, it's simple, and it's very valuable. The other thing we should mention maybe is that, you can take a picture of this chart over here, is that we're always talking about the muscles and how they open up. All of these tissues, for the most part, let's just say the majority of these tissues, heart and lungs, etc., digestive tract, they can contract and expand as well, just like the hamstring does. So when you clear the nervous system, these tissues start to expand better as well. In fact, we're going to start taking something called tidal lung volume before and after adjustments and show the breathing capacity before and after adjustments as well. Okay, so let's get your upper thoracic on our way down to your lower left back and see what we get. Hang in there. So it's just kind of tight, actually. Hang in there. Good. Tough. All the dancing area, huh? It's competitive out there. Okay, so we started at 75, and now look at him. That's ridiculously better. That's crazy. Wow. Okay, bend your right knee, and we're gonna do your lower back. Open that, fold your arms across your chest. I got you. I'm gonna set you up perfectly. Good. And then we're gonna get your belt. Good job. Let me show you this real quick. So an adjustment, here's a popping sound that was so interesting to people, is just the joint opening and exchanging fluid. So there's nothing to be afraid of. That, you can do that throughout life, from birth to death, every age. It's safe. Let's see if we get this one. So Sasha's kind of tight, but let's see what we get. Excuse me. I'm gonna get your hip on this side too. Oh, that went good. All right, so we're gonna see what we get out of it. So first thing we want to do is bring both feet off the table. You reported some lower back pain. Is there still lower back pain? No lower back pain. So the pain part's gone. And then we had 75 degrees when you started to grimace a little bit. That's a good word, I favorite. And here we are now. No grimacing out to 130, 140 or whatever. Okay, over on your stomach, we do that last test just to show people what happens in extension. So you're in extension as well. Here we go. You might help me out with that, that's great. Okay, so without bending your knee, bring your left leg off the table in one piece as high as you can. Okay, and now relax. And now the right side. Excuse me. Wow, that's great. There it is. I mean, his body's way better prepared to perform in ballroom dancing now than it was before we did this, and it only took us 5 to 10 minutes to get here. Okay, that was great. Sasha came in with the intention of improving his ballroom dancing ability, and what we got out of it was a huge increase in hamstring flexibility and symmetry in his pelvis, and basically things you'd use for dancing. So you don't need to be hurting to benefit from top-down, inside-out chiropractic. Be sure to like, subscribe, and hit the notification bell, and come back for more videos. Thanks for coming today. Thank you.